Hello, everyone, and welcome to the Body and Soul Expo podcast, your go-to source for holistic health and wellness. I'm your host, Bruce Starr. Mark your calendars and join us on Sunday, October 26th at the beautiful Palm Beach Gardens Marriott, because it's going to be an absolutely incredible event, a truly transformational day you won't want to miss. We're proud to have sold over 60 incredible vendor spaces in just 6 short weeks. Most vendors are also powerful, innovative speakers sharing profound insights into a world of new and tried and true healing modalities and products. You'll just have to be there to discover it all for yourself. The Expo is a culmination of Lauren's nearly 3 decades in the health and wellness arena and owning spas, and my 4 decades in the entertainment industry, from being a Hollywood talent agent and manager to television, radio, and podcasting. So for all the latest updates, information, and exciting news and special announcements, please look for and follow our Body and Soul Expo Facebook site. And for a deeper dive into what the Expo will offer, definitely visit our bodyandsoulexpo.org website and take the time to investigate all you will see there. Now, today we'll have another inspiring episode of the Body and Soul podcast, where we showcase the incredible talents and experiences and knowledge of the wonderful vendors who will be appearing at the Expo. Today's guest is Melanie Jones, FNP-BC. She is a board-certified family nurse practitioner with over a decade of experience. She has blended traditional medical expertise with a passion for holistic and functional health. Melanie earned her degrees in nursing from Florida Atlantic University. She has completed advanced training in functional medicine and bioidentical hormone replacement therapy. She'll have to explain all about that. She's currently pursuing a second board certification in functional medicine through the Institute of Functional Medicine, IFM. Today we welcome Melanie Jones to the Body and Soul Expo podcast. So, Melanie, it's great to have you on the show. I look forward to learning all about you. Can you tell me kind of how you got started doing what you do, and what is it that you do?
Okay, so I am a board certified family nurse practitioner, and I started as an RN in mostly cardiac in the hospital. And when I was working in the hospital, I got to see patients at their worst, really, after chronic conditions had caused complications. So as I was working, I decided what I would like to do is approach patients, get patients in before they were experiencing complications and start working with people before they were hospitalized. So I went back to school and I got my nurse practitioner, which is an advanced nursing degree. And from there, you can diagnose, treat, and prescribe. I worked with some great doctors in primary care, and I worked in private practice, walk-in clinics, and was happy because I was getting to see patients before hospitalization, but then realized that we were still managing chronic disease. We weren't preventing anything. We were just treating, managing their medications and managing their chronic disease. So I started my journey with functional health, learning along some really fantastic doctors that were Harvard trained and Duke trained. And I was lucky enough to stand side by side with them and to look at the root cause. And that's what functional medicine is finding the root cause to prevent chronic disease and improve quality of life. So that's kind of everything in a nutshell.
So I'm curious, how were you received coming across and offering this alternative method of approaching health? I'm curious to hear about this.
Yes, it's not easy to break the chain. We've trained people in our society that, you come into the doctor's office, you get a pill, you're going to feel better. With functional health, it's a long process. We have a long process of investigation. We have to go through extensive medical history, background in what you're eating, what kind of movement you're doing, what kind of exposure you have to toxins in the work environment or in your home. So it's a long, tedious process. But once patients have been through the primary care process and they're not getting better and they're not getting the results that they want, they're more open to starting that journey and going through that process. But it does take a shift in thinking and expectations as well.
So, what kind of person, what should they be thinking? What should they be experiencing uh, before recognizing they need to come to you?
A lot of times we get patients who are either on medications with their primary doctor or have never been on medications, but they've had labs done and they're told everything's fine, everything's normal. There's nothing wrong with you, but they're tired. They don't have as much energy as they used to. Maybe their libido is non-existent at this point. They just can't keep up like they were keeping up before, and they realize that something is wrong, or vague symptoms like stomach pain, changes in bowel movements, bloating and weight gain that's slowly building up over time. And they go to their practitioners in primary care and they're told, we don't see anything wrong with you, everything's fine. And they send them home without a solution.
That sounds like my day, by the way, you just described. So, I don't know, I might have to come.
Yeah, it's a lot of people's days. And so, just because your lab markers aren't in a chronic state of disease doesn't mean nothing's wrong, right? So, we look very much at symptoms and the history and dig really deep and spend a lot of extra time with patients, to try to find the root cause.
So, what do you prescribe? Uh, Obviously, pharmaceuticals is not first on your list. What is it that you talk about with these people that you see?
The first thing that we talk about is diet and exercise and sleep and mindfulness. Those are the things that we can control. They're free most of the time, so they're easy to get a hold of. They're easily accessible. I'm not opposed to pharmaceuticals. They have their place, but like you said, that's not my first choice in most cases. Sometimes we do have to jump on. I recently had a patient who hadn't had labs in many years, hadn't been seen by a primary, came to me. We did labs, and lo and behold, he was full-blown diabetic. So I have to start pharmaceuticals at that point. So they have their place. And then I look very much into hormone balancing. So I work with bioidentical hormones, peptides. Most of the peptides we think of are that GLP-1s for weight loss, but there are other peptides that aren't specifically for weight loss. So we can look at that as a more natural approach. And then supplements. So are you getting enough vitamin D? Are you getting enough B12? And then first and foremost, are you getting those through your diet? And then do we have to supplement that?
That sounds great, actually. I like what you're saying. I know vitamin B12 is sort of like a miracle. I don't know what to call it. It's a vitamin, but
Yes.
tell me about vitamin B12.
So vitamin B12, it plays a role in all cells of the body. It helps with cell turnover. So you're getting rid of like the garbage that's floating around. It helps with your blood health. So red blood cell turnover and anemia. It helps with energy. And it helps with metabolism, so many different roles. And then it helps us metabolize and utilize nutrients more efficiently. It decreases inflammation. We look at the B12 with things like homocysteine levels that can put you at risk for heart disease from chronic inflammation, and B12 is a big player in lowering homocysteine and decreasing heart disease risk.
So when people ring your doorbell and want to come in and see you, and it's kind of similar, I assume, in the beginning to what they would expect in a regular medical office.
Right. So I do most primarily telehealth. So I start all of my visits with a phone consultation to set expectations. Not everybody's fine with just telehealth. Some people want hands-on. So that would be someone that I would say, well, maybe we could find you somebody else. But I start with the phone conversation to make sure that this is what they're looking for, what my approach is, and then what labs we need to start with. So from the phone conversation, we set up the labs. And once I get the lab results, we set up the visit, much like what you and I are doing, a video visit. And then from there, they fill out my history form so I can take a look at what's going on in their medical history, diet, things like that, their main complaints. And then we work together collaboratively to come up with a reasonable, effective treatment plan that they can stick to and live with.
I'm glad I asked you that last question because I didn't have any idea that you did this over the phone. Just yesterday, I had my health insurance company call me and ask me all these questions. I guess it's like a yearly thing. And she
Mm.
said, well, how many pharmaceuticals are you on? I said, none. She said, none? And I said, yeah, I'm not on pharmaceuticals. I almost apologized because
Right.
I've heard people are on 8, 9, 10, 11, 12 of them now, which is
Right.
uh, uh, mind-boggling.
It is. It is. Yes. So there's a lot we can accomplish over the phone and on a video visit, and accessibility is really my primary goal. So if someone has trouble leaving work, they can see me on a break during their lunch break, or as soon as they get home, they don't have to get a sitter or pack up the kids into the car. So I'm looking for accessibility, and telehealth seems to be pretty accessible. And then I'm very accessible by phone, text, so I'm very hands-on with my patients.
While we're talking about that, tell us what's the best way for people to communicate with you?
So I have my website. It's joneshealthsolutions.com. And then right now I'm just networking like this. I'm pounding the pavement, talking to people, looking for referrals, my phone number, my text, my email, and my website. So any way you can get a hold of anybody, you can get a hold of me that way.
Okay, excellent. So when people come and hear you speak at the expo, have you decided what exactly you're going to speak about?
My primary focus is hormonal balance and also lifestyle modifications.
Okay, excellent. And then when people come to your booth, uh, what can they expect as part of the interaction from you to get them interested in what you're doing?
And so we'll be just having a conversation. Any vague symptoms, seeing practitioners and not getting answers, being referred to multiple specialists and still being told everything's fine. Those are the biggest patients that I am looking to help. And it's personal too, my husband and I, my family, we all like I'm kind of the medical provider for the family. So everybody comes to me, and especially after they have been through the ringer of multiple appointments and not finding answers. So those are the best conversations that I have, and really just answering questions. And that's how I find my patients, is just talking, answering questions, and coming up with a reasonable plan, and then move forward from there.
Hey, how terrific is that? That when people come visit you at your booth, and it's going to be a pretty long day, 9 a.m. to
Yes,
6 p.m., and we expect a lot of people. So
good.
be ready to answer a bunch of questions. Anything else before we go?
I thank you for having me. I'm really excited to be a part of all of this and get the word out. And I'm really excited to just fill that gap in our medical system that's not being addressed. People are being sent away, told they're fine, and they're not fine. Women are not being treated appropriately with hormone balancing, and men too. And then we're really lacking in education for lifestyle, exercise, diet, and people are forgetting that mindfulness and sleep, and they're just as important as anything else in life. So I'm looking forward to sharing all of this with everyone.
And you mentioned right before we went on camera here that the networking is going to be so important. Could you imagine a whole day of people interested in health and wellness together with 60 vendors that are the top of the chain, talking their skills. And it's not going to be only 60 because each booth will have one or two people. So you'll
Hmm.
literally have could be 120 to 180 people who all are aware of top health and wellness secrets and things to do. So it's going to be very exciting. I can't wait. And you know what? We're going to do it went over so well, and we sold so many booths so quickly. We're going to do another one next April.
Awesome. That's great. I'm glad to hear it. I'm really excited.
So thank you for being on the podcast with us, Melanie. I learned a lot and just so impressed with you and so many of the other people that are going to be there. This is just going to be an incredible event. And thanks for being on the show.
Thanks again for having me.